There's something older men don't usually talk about, not with their doctor, not with their spouse, sometimes not even with themselves. But here's a fact most don't realize. What you do in the privacy of your own bedroom, especially after age 60, can dramatically affect your prostate health. So let me ask you, could daily ejaculation actually protect your prostate, or are you unknowingly doing long-term damage? Does frequency matter more than technique? Or is it all about how your body is changing with age? And perhaps the biggest question of all, what happens when you stop completely? I've spent more than 30 years as a medical doctor specializing in male aging, vitality, and prostate health. And one thing I've learned is this: most men over 60 have no idea how their prostate responds to sexual activity until something goes wrong. Hi, I'm Dr. Sophia Mills, and welcome to my channel. If you're new here, this is a place where men over 60 reclaim their strength, energy, and confidence without the confusion or medical jargon. And if you're returning, welcome back. I'm proud of the progress you're making. Before we begin, do me a quick favor. Like this video, it helps more men find this vital information. Subscribe to the channel so you never miss powerful advice like this. And drop a comment below telling me where you're watching from and how old you are. I want to know where my community is tuning in from. Every one of you matters. Now, let's talk honestly about what daily ejaculation might be doing to your body and your future. Let's start with what we know for sure. The prostate is a small gland, about the size of a walnut sitting just below your bladder. Its job? Producing the fluid that nourishes and carries your sperm. Simple enough, right? But once you hit your 60s, this little gland becomes a major player in your health story. Why? Because this is the age when many men start noticing signs of an enlarged prostate, frequent urination, weak stream, dribbling, or even disrupted sleep due to nighttime urges. Now here's where it gets interesting. Multiple studies, especially one from Harvard, have shown that ejaculating frequently, 21 times or more per month, may lower your risk of developing prostate cancer. Surprised? So was Gerald, one of my longtime patients from Indiana. At 66, he had no major health complaints, just occasional nighttime trips to the bathroom. But he was nervous. His older brother had passed from prostate cancer at 71. When we ran his labs, things looked okay, but his PSA was starting to creep up. That's when we had an honest conversation about his habits. Turns out Gerald hadn't ejaculated in months. Stress, low libido, embarrassment. All common. Together, we made some simple changes, more movement, natural supplements, and yes, we discussed bringing back regular sexual release, whether with a partner or solo. 6 months later, his PSA stabilized. He was sleeping better, and perhaps most importantly, his confidence returned. Now, let's be clear. I'm not telling you that ejaculation is some miracle cure, and I'm certainly not suggesting you push your body beyond comfort or desire. But I do want you to understand that prostate health is deeply connected to regular function. Imagine this. Your prostate is like a small sponge. When it doesn't release fluid regularly, that fluid can build up. Over time, stagnation might lead to inflammation. Inflammation can lead to swelling. And swelling, that's what causes all those frustrating bathroom symptoms. But here's the other side of the coin. Too much of anything, especially without recovery, can backfire. Meet Alan, age 63, a recently retired gym teacher from Florida. He came to me complaining of chronic fatigue, brain fog, and reduced drive. But his labs were normal. His testosterone was decent. His heart and BP were in good shape. But something didn't add up. So I asked the right questions and found the missing piece. Alan, still very active in his sex life, was ejaculating every day, sometimes twice. At first it was to keep the pipes clean, as he put it, but over time it became routine, then compulsion, then exhaustion. He didn't realize that too frequent ejaculation in men over 60 can deplete dopamine and reduce testosterone temporarily. That means less motivation, weaker workouts, and in some cases, feeling drained emotionally and physically. Once we adjusted his routine, scaling back to a few times per week and focusing on recovery, his energy returned. No pills, no hormone therapy, just balance. So here's the takeaway I want you to think about tonight. It's not about yes or no, it's about listening to your body and understanding how your habits affect your aging prostate. Daily ejaculation might be helpful for some. For others, it could be pushing too hard without proper rest and nutrition. But one thing is clear: doing nothing, going weeks or months without any release, might increase your risk of stagnation, inflammation, and long term issues. So ask yourself, are your habits intentional or just automatic? Is your body giving you warning signs that you've been ignoring? And could small changes right now prevent years of frustration later? In the next part of this video, I'm going to walk you through the biggest myths about masturbation and prostate cancer, what happens hormonally when you ejaculate after 60, and how to create a safe, healthy rhythm that supports your long term energy and confidence. Trust me, you won't want to miss what's coming next. But first, I want to hear from you. Drop a comment and let me know. Where are you watching from? How old are you? Have you noticed any changes in your prostate, libido, or energy? Your experience matters. And the more we talk openly about this, the healthier we all become. So now you know ejaculation isn't just about release or desire, it's about function. And for men over 60, that function is deeply tied to long term prostate health, hormonal balance, and quality of life. But let's address the elephant in the room. Because I know what you're probably thinking. Wait a second, didn't I hear somewhere that too much masturbation could cause prostate cancer? Or that it drains your testosterone and makes you weaker? Or even that after a certain age, it just doesn't matter anymore? These are the kinds of myths that confuse, frustrate, and silence men. So today, I'm going to clear them up once and for all. Let's start with one of the most dangerous beliefs. Myth 1. Ejaculation causes prostate cancer. This simply isn't true. In fact, a landmark Harvard study that followed over 31,000 men for nearly 2 decades found the opposite. Men who ejaculated 21 or more times per month had a 33% lower risk of developing prostate cancer than those who did so less than 7 times a month. That's a massive difference. Now, does this mean ejaculation is a guaranteed form of cancer prevention? No, but it does suggest that regular release may help flush the prostate and reduce cellular inflammation. Let me tell you about Carlos, age 67, who came into my clinic in Phoenix with a PSA of 5.2, borderline high. He hadn't been sexually active in years. He figured at his age it didn't matter anymore. But after some lab work and an honest conversation, we set a new goal: bring back circulation, connection, and a little spark in his routine. 3 months later, his PSA dropped to 3.8. No surgery, no medication, just smart lifestyle changes. Sometimes the body just needs a reason to work better again. Myth 2, masturbation drains your testosterone. This one is tricky because, like many myths, it's rooted in partial truth. Let's break it down. Right after ejaculation, especially in men over 60, there's a temporary dip in testosterone levels. But, and this is key, your body rebounds quickly. In fact, occasional sexual release can actually support testosterone production long term because it keeps the reproductive system active and healthy. But what if you're overdoing it? That's when you might feel those side effects: brain fog, low drive, poor recovery after workouts. Mood swings. Think of it like lifting weights. You don't get stronger by lifting heavy every single day. You get stronger by giving your body time to rest and rebuild between sessions. Same with your sexual function. Use it, yes, but don't abuse it. Now let's talk about something few doctors ever mention: the emotional effects of shame around masturbation. I've met hundreds of men in their 60s, 70s, even 80s who've carried guilt for decades. Some were raised to believe touching yourself was wrong. Others felt embarrassed because they no longer had a partner, and many just assumed their body wasn't allowed to want pleasure anymore. Let me be clear, you are still a man, you are still allowed to feel, and your health improves when you honor your body, not shame it. I'll never forget Harold, a 73-year-old widower who told me he hadn't ejaculated in 9 years. He said, "Doc, I figured that part of me was dead." But after some honest heart-to-heart talks, he started reconnecting with his body again, through massage, light stretching, and yes, eventually, solo release. His energy came back, He smiled more. His sleep improved. And he even reconnected with an old friend who later became his girlfriend. Let's now talk hormones, because this is where things get interesting. You might assume ejaculation is just about the physical act. But after orgasm, your body releases dopamine, pleasure, oxytocin, connection and bonding, prolactin, satisfaction and recovery. These aren't just feel-good chemicals. They help regulate your mood, sleep, and even metabolism. But here's the key. The older you get, the slower your hormone systems recover. So if you're ejaculating daily without enough rest, your prolactin can stay elevated, which suppresses dopamine and testosterone. That's when you might feel sluggish or down. So what's the sweet spot? Finding your balance. There's no perfect number. Every man's body is different. But here's what I recommend for most men over 60. 2 to 4 times per week is a healthy rhythm for hormone balance. Make sure it's not compulsive. Listen to your energy, sleep, and drive. Prioritize quality over quantity. Deeper arousal, better relaxation afterward. Focus on blood flow and breathing, not just getting it over with. Let me give you a quick visual. Imagine your prostate is like a small filter system. If it runs regularly, things stay clear. If it never runs, or runs too hard, too often, it clogs or wears down. Balance is everything. And here's one more thing I want to address, because I get emails about this every week. Doc, I haven't felt desire in a long time. Does that mean I'm broken? Absolutely not. Loss of libido can come from dozens of causes. Low testosterone medications, stress depression, even long-term loneliness or grief. And if that's you, please don't ignore it. There's help, there are solutions, and there is nothing wrong with asking for support. In fact, in part 3, I'm going to walk you through the biggest reasons men over 60 lose desire, how to restart your libido without medication, and the simplest daily habit to keep your prostate healthy, even if you're not sexually active. So stick with me. You've come this far, and I promise, the best part is still ahead. If you haven't yet liked this video, subscribe to the channel and leave a comment letting me know. What's one question you've always had about your sexual health but never felt comfortable asking? Your question might help another man get the answers he needs. Before we go ahead, there's one more thing you need to know. Because while today we are talking about what daily ejaculation does to your prostate, most older men are still making silent mistakes when they touch themselves. Mistakes that silently sabotage their sleep, testosterone, and confidence. So after you finish this video, don't miss my other deep dive. If you're over 60, stop making these masturbation mistakes. Trust me, even one of these habits could be holding your body back. Watch that next. Your prostate will thank you. Now let's take a deep breath here. We've talked about the myths. We've talked about the hormone shifts. We've even talked about guilt, shame, and emotional blocks that many older men carry silently. But now let's focus on something much more powerful. How to take control, how to feel desire again, and how to protect your prostate, whether you're sexually active or not. Because here's the truth. You don't need a perfect libido to be healthy. You don't need daily sex to stay sharp, energized, and confident. And you definitely don't need to perform like you did in your 20s. You just need to listen to your body, adjust your habits, and make small, sustainable changes. Let me show you how. Why men over 60 lose libido, and what to do about it. One of the most common complaints I hear from men in their 60s and beyond is this. Dr. Mills, I just don't feel like I used to. The desire is gone. But what most don't realize is that this drop in libido is not just about aging. Let me introduce you to Dennis. He's 70 years old, retired, with no major health issues, but hadn't felt aroused in almost a year. He thought it was age. He thought it was just how it is. But during our session, I asked a few key questions. Are you sleeping well? What's your stress level? Are you on any blood pressure meds or antidepressants? Boom. There it was. Dennis had been on a low-dose beta blocker for 3 years, plus a nightly sleep aid, both of which, unbeknownst to him, can crush libido over time. We worked with his primary doctor to adjust his meds safely. added some magnesium, light stretching before bed, and daily 20-minute walks for circulation. In 6 weeks, the spark came back, not like a teenager, but enough for intimacy, laughter, and the return of confidence. The lesson? Low libido isn't always hormonal. It can be caused by stress, poor sleep, medications, alcohol, even dehydration. Restarting desire without pills. You don't need a prescription to feel like yourself again. Here's what I recommend to most of my male patients over 60. 1. Mind the morning. Your morning wood, or lack of it, is a key signal. It reflects your circulation, testosterone, and nerve function. No morning firmness? That's not normal, it's a red flag. Start by doing leg exercises in the morning, lunges, squats, or even a walk. Why? Because your blood vessels don't just serve your heart, they serve your pelvis too. 2. Breathe into the body. Sexual energy is built on parasympathetic activity, your body's rest and digest mode. If you're constantly stressed, rushing, angry, or tense, your desire shuts off. Try this. Each night, place one hand on your chest, one on your belly. Breathe in slowly for 4 seconds. Hold for 2. Exhale for 6. Repeat for 5 minutes. It lowers cortisol, calms nerves, and reboots natural desire. 3. Reconnect with pleasure without pressure. So many men treat masturbation like a mechanical task, in and out, quick and silent. But what if you slowed down? What if you made it about feeling again, not finishing? Try massage oil. Try touch without any goal. Try noticing what feels good instead of what should happen. You might be amazed at what your body remembers. What if you're not sexually active? Here's a question I get often. Dr. Mills, I haven't been intimate in years. Is my prostate at risk? The answer, not necessarily, but you do need to support your body in other ways. Think of it like this. Ejaculation is one way to flush the prostate. But if that's not an option for you, whether due to medication, surgery, widowhood, or preference, then let's support your system differently. 1. Movement. Physical activity increases blood flow to the pelvis. Walking, climbing stairs, yoga, tai chi, it doesn't matter. What matters is movement. Movement, circulation. Circulation, nourishment to the prostate. 2. Hydration. Your prostate gland produces fluid, and like any fluid-producing organ, it needs hydration. Drink half your body weight in ounces per day. E.g., if you weigh 160 pounds, aim for 80 ounces of water daily. Less fluid, thicker semen, more inflammation risk. 3. Reduce inflammation. Limit processed foods, fried items, and sugar. Focus on berries, pumpkin seeds, tomatoes for lycopene, green tea, omega-3s from fish or flaxseed oil. These foods naturally reduce swelling and support prostate function, even if you're not sexually active. Let me tell you about Martin. He's 74, had prostate surgery 5 years ago, and hasn't ejaculated since. He came to me feeling empty and unsure what to do. We focused on daily stretching, pelvic floor strengthening, anti-inflammatory nutrition, and emotional healing. Today, Martin says, I may not function the same way physically, but I've never felt more connected to myself. That's the power of awareness. Here's your daily prostate health toolkit. You don't have to do it all at once, but start here. Ejaculation, 2 to 4x a week, if possible. Daily hydration, 80-100 Oz of water. 20 to 30 mins movement. Anti-inflammatory diet sleep. 7 or 8 hours. Breathing practice. Emotional connection with self or partner. These simple steps, done consistently, can do more than any expensive supplement or medication. Remember, your prostate is a gland. It's not the enemy, it just needs care. Daily ejaculation might help, but only if it aligns with your energy and rhythm. Shame kills desire. Openness brings it back. You're not broken, you're evolving. Before I let you go, I want to hear from you. What part of this video opened your eyes the most? Have you struggled with libido, shame, or questions around ejaculation after 60? Leave a comment. I read every single one. You're not alone, and your story might help another man feel seen. And if you found value today, like this video, subscribe to the channel. Share it with a brother, friend, or partner who might need to hear this. This is Dr. Sophia Mills, and I'll leave you with this. Your health isn't fading. It's just asking for a new kind of attention. You're stronger than you know, and your best days can still be ahead.